Hi, I'm Sam. I'm the medical massage lady here on YouTube. If you've not seen any other videos by me or posts, I am a sports therapist with a medical background. I've been doing massage in one way or another for 23 years, and I have a surgical and midwifery background. I will be doing lots of posts on various topics. It could be sports injuries, prevention of them, how to treat them, how to recognise them, or it could be dealing with medical issues, including pregnancy and postnatal related health. It could be disability. I also have experience with physical disability in children, specialising in cerebral palsy. So any of these topics could be covered. So there will be quite a variety of information coming your way. If you want to know more, you can check out my Facebook page or Instagram account. I believe the links are down below, or you can subscribe to my channel on here and there'll be lots more videos coming your way. So for my first video here, I'm actually going to be talking about some more general things to do with massage. I get asked a lot of questions in my job about what it's like being a massage therapist. And also, there's quite a few embarrassing questions that people are sometimes not too sure if they should ask or not. But certainly, when you tell people that you're a massage therapist, you usually get a bit of a nudge, nudge, wink, wink. But there's also quite a lot of interest in how we work and techniques that we use, what sort of things we can help with. So hopefully I will answer some of those questions for you here today. So one of the first questions I get asked quite a lot is, did I have to go to college to do this job? Answer is yes, depending on what kind of therapist you see and what kind of therapies they offer. The training obviously is completely different. So for me personally, I am Swedish massage trained originally. That's what I did 23 years ago, which was basically an IHBC diploma. And what that involved was probably about 200 plus hours of anatomy and physiology, business studies, health and safety, preheat treatments, so including things like saunas, steam baths, which also obviously very beneficial from a relaxation and a health point of view. We then obviously had a lot of practical sessions in with that. I was then a surgical nurse for quite a few years, covering pretty much every type of surgery going, followed by being a midwife. So obviously between the two of those, we're looking at about 4.5 years worth of training, again, covering extensive anatomy and physiology, and various other topics, psychology and all sorts. And then since then, I have qualified as a sports therapist, doing my active IQ diploma, which again was a few more months on top. So quite a lot of training, but obviously every therapist really does differ. And what I would say to people looking for a treatment is, ask these questions, because what one therapist can offer may not be right for whatever issue it is that you are wanting to get a massage treatment for. So at the end of the day, you want to get the most out of your treatment, so make sure that they have some experience dealing with your particular issue. So the next question is, I get asked a lot, do my hands get tired doing massage? Well, we do sort of try to do a lot of hand exercises just to kind of stretch the muscles out and keep everything flexible and relaxed so that we don't get pain or any injuries. But it is inevitable that, you will get tired some days. Certainly if you're doing a sports, that's a lot heavier going on your joints. And if you've got some big rugby player, that's going to take its toll on your hands a lot more than if you've got, a really sort of slim built young woman. So yes, they do get tired, but we do try to be aware of our posture and carry out good body mechanics to avoid injury. But certainly it is very well known fact that massage therapists, we do tend to go on to develop arthritis. We do get things like tendinitis in our wrists and elbows, as I have, and sometimes shoulder issues as well. So it's important for us to kind of be aware of our weight and how we're sort of shifting our weight while carrying out certain techniques. So, do I find my job relaxing? Well, I think anyone in healthcare, you can't really do this job, whether it's nursing or massage, whatever it may be. I don't think you can really do this job if you don't enjoy it. I'm very fortunate that I've loved all of my jobs and can't really imagine doing anything else. And I think that the satisfaction that you get from when you're helping people and when you make a real difference in how they can carry out just basic daily activities really makes it worthwhile. So, but I think usually when you're carrying out treatment, you're so focused on delivering a good treatment and on what their issues are, how they're reacting to certain parts of the massage, and just sort of generally their sort of mood and how they are through the treatment, that you don't really think about sort of relaxation yourself. Certainly a sports massage is not particularly relaxing, but yes, sometimes if I'm doing a Swedish massage or if I'm doing a scalp massage, especially if there's relaxing music going, it can be quite relaxing, and I suppose almost like a form of meditation when you're carrying out sort of slow and rhythmic strokes. So yeah, it can be relaxing. Okay, next question that I've been asked is, do I prefer to be called a masseuse or a massage therapist? Well, everyone will differ on this point of view, but I think the general view, although I don't really mind, the general view does seem to be that the word masseuse kind of has a few illegal connotations and gives the impression of those extra services that all of us registered professionals do not offer. I don't take offence if someone calls me a masseuse, but sometimes I think I find it easier to say a sports therapist, and I find that people generally kind of take that more seriously and kind of get the impression that you're a bit more educated for some reason if you say sports therapist. But that's what I am. I am also a massage therapist, so whatever term people want to use is fine with me. Okay, so next question I get asked is, how do I let my massage therapist know if I don't want to talk? Well, clients really vary on this. Some like to just talk the whole way through, particularly if it's their first massage and they're quite nervous. Others just really want to just come in, chill out, not say a word. and either of those is fine with me. Apart from gaining the initial sort of medical information and things that you would find out in the initial consultation, there really isn't the necessity to speak, although in sports massage you do need to sometimes, because you need to assess sort of the state of the muscles. You need to assess pain levels. If it's too much pressure, that's really important in a sports massage. So you have to get client, responses throughout the massage, and also sometimes to see if a certain area feels worse or better, or if something feels a bit looser after you've worked on it. So communication during the sports really is vital. But as far as a Swedish massage and even a deep tissue go, if the client wants to relax, that's what they're there for. I'm certainly not going to be offended if people say they don't want to talk. I will just focus on my job and get on with the treatment. Sometimes, when you go for a massage, you just want to be in that moment. So not a problem if you don't want to engage in conversation. Will I insult my therapist if I say that the pressure isn't deep enough? Well, as I've just said, communication sometimes is essential, just in order for us to provide you, the client, with the best therapeutic experience possible. I certainly wouldn't be offended if someone asked me to adjust the pressure, and I have had clients do that, as apparently I'm stronger than I look. So sports massages in particular can be quite intense, can involve a lot of pressure. So it really is important to get some feedback from the client. And if it's too much, then, as a therapist, I need to back off, because you don't want the massage to have the opposite effect to what it is you're working towards. So it should never be painful. With sports massage, I would always say to the client, pain level of 7 to 8 out of 10 is a good thing. You're going to expect that if the muscles are really tight, which is generally what you're using a sports massage for. But if it's going to a 9 to 10 out of 10, I want to back off, basically, so that I don't get kneed in the face. So yeah, you need to know how the client's feeling about the pressure, and clients absolutely shouldn't feel that they're offending their therapist or anything by saying that it's too much or not enough pressure. Everyone's different. Everyone's going to respond differently to pressure, depending on how tight their muscles are, whether they've had a good night's sleep, all sorts of different factors. So each client is an individual, and you really have to treat them as such. So okay, so the next question I get asked is, am I supposed to tip my therapist? Well, it's never essential to tip your therapist wherever you work. I have had a few clients do it, and that's fine if they really feel that it's necessary, but there's really no need. We're just doing our job, and if you feel the service is particularly great, sometimes providing feedback, whether it's an online review or just verbal feedback, is actually just the best sort of form of appreciation that we can get. So absolutely no obligation to tip. If I fall asleep on the table, does this make things difficult for the therapist? Well, The quick answer is no, it doesn't. I would say this really tends to only happen in the Swedish massages, sometimes with the scalp, which clients do find particularly relaxing. But I think if a client is that comfortable and that relaxed with you that they are falling asleep, then, I take that as a compliment. And, it just allows me as a therapist to get on with, the healing process and ensuring that you have a good, relaxing experience, which is probably, in the case of a Swedish, what you came for. So not a problem at all. I've had quite a few people snoring, and it's fine. So the next question is, could massage ever make things worse rather than better? Well, yes. There are occasionally situations where a client will have a medical issue or maybe a sports injury or something, some sort of acute problem, where maybe there's still a lot of inflammation or something, and it can make things worse, certain medications, for example. But this is why if you go to a good, registered, experienced therapist, you will get asked for medical information. I usually actually email it out to my clients before their appointment. And the point of this is to ensure that, you're not going to do the client any harm. And again, in terms of sort of communicating with regards to pressure and things like that, obviously people such as diabetics, can get problems with their nerves and sensation, and they can suffer areas of numbness. So if there's anything like that, you want to be a little bit more cautious. But yeah, generally, if if you as the client are open with the therapist about any health issues, it is of course all kept confidential. Then we have all the information that we need to make a good decision on what type of massage would be best for you, and if there's any techniques that maybe shouldn't be used, we can just adapt the massage accordingly, really. So not a problem. I think there's been very few issues. Only once or twice when I've had to say to a client, I actually can't massage you. Usually it's just a case of adapting the techniques and just working around something a little bit, so not an issue. Next question. Why do I sometimes get a headache after a massage? Well, it doesn't happen very often in my experience, but massage does have an effect on, the vascular circulation, and potentially this could bring about a headache. Also, if there is excessive pressure, maybe if you're having a facial massage, excessive pressure around the sinus cavities, or just from being face down in the face cradle, if there's any kind of pressure around that area, it could again bring on a headache. But if the face cradle is uncomfortable, you don't have to use it. Some of our tables have a face hole. Again, it's the client's preference, really. And that actually brings me on to the next question that I get asked a lot, which is, why does my therapist tell me to drink a lot of water? Actually, your body does lose a lot of heat during a massage, and so it's a good idea to just keep up with the water intake, maintain hydration, which again will avoid onset of any headaches. But also, apart from the whole sort of massage generating heat thing, it one of the benefits of massage is that it helps to assist with excreting toxins from the system. And obviously, if you're maintaining hydration, that is only going to, further the benefits of any detoxification that happens during a massage. Okay, so then we have the slightly more embarrassing questions that clients ask, which I actually don't really find embarrassing, because probably part of having been a nurse and a midwife. But a lot of people, the biggest question I probably get is from men, and it is, what happens if I get an erection during a massage? Well, let's face it, erections are a completely natural thing. All men get them at one point or another. It can't really be controlled, and, you shouldn't really feel embarrassed if you do happen to get one. At the end of the day, you're covered with towels anyway. It's not like it's just out there in the open. And it's entirely the client's preference. If you do get an erection, you can request, if you're really not comfortable, to stop the treatment. Or, personally, as a therapist, I'm happy to just carry on, as I'm sure most therapists would be. As long as the client's dignity is maintained, there's really not an issue. So it's just down to the client's comfort, really. But to be honest, as a therapist, we're so focused with what we're doing in terms of carrying out the massage that an erection's really not an issue. So we just take it as a compliment that you are feeling very relaxed, and that the massage feels good. Okay, a few more questions. I get asked a lot by our female clients, do you mind if I haven't shaved my legs? Well, no, we all have days, winter months. A lot of us women, can't really be bothered because you're wearing trousers, so it's like, what's the point? Ladies always worry, that they're going in and they've got hairy legs. Honestly, our male clients, they don't apologise for not having shaved their legs, and we still massage them. It's not an issue. Whatever you're happy with, we're still going to massage you. We're more focused on the muscles than how much hair is there. So shave your legs or don't. Either is fine. Okay. Very common question now. Should I tell the therapist if I need to pass wind? Well, it's entirely up to you whether you tell the therapist or not before you let it out. Again, like erections, wind is a completely natural bodily function. We all do it, and during a massage, the body completely relaxes, and especially if you're having a stomach massage, that will aid with the peristaltic movement of the bowel, helping to push any feces or gas around the bowel towards the rectum. And so, yeah, you might need to pass some wind. It's really not a problem. And you've got no need to feel embarrassed about it. We all do it. And you're going to feel a lot better for letting it out at the end of the day. If, you spend more energy really trying to hold it in, and then you just sort of end up stressing yourself out about this big bubbly fart that wants to come out, and it's no big deal. So just let it out, then you can carry on relaxing with your massage. not an issue at all. Okay. Next question. Is it better if I don't wear underwear for my massage? Again, everyone's different. Whatever the client is comfortable with, as long as the therapist is maintaining your dignity, with towels, and that you're comfortable, that's the main thing. Some people like to wear underwear, some people don't. I do find that a lot of our female clients generally tend to come wearing a G-string or a thong anyway. But also it depends on what kind of massage you're having, because if you're having like say a sports massage on your back, and we're working into the glutes, then your underwear can just be lowered down so that we can access the sort of top of the gluteal area. If it's a Swedish, then we might want a bit more access. But if you're not wearing underwear, then we have a very lovely modesty towel, which will cover all the bits that we don't need to see. So yeah, really it's entirely down to the client. Next question, what if I get ticklish during a massage? Again, it's an issue that a lot of people have. Completely normal to feel ticklish. It does kind of depend on the techniques being used at the time, how sensitive you are sort of with regards and pain levels and everything. Hormone levels can all affect it as well. Generally, obviously, feet, knees, inner thighs, and just around the side of the sort of around the flanks, around the sides of the back, tend to be the most ticklish spots. We can just adjust the pressure. Sometimes just by adding a little more pressure, it can actually help the client overcome any ticklishness. Or alternatively, you can adjust the technique, or just sort of move off to another area. Just adjust it if you sort of change technique or change the pressure and it's not quite making a difference, then you can just go on to another area and just leave that bit that you're doing, and that's fine. Okay, final question. People ask, is it weird touching naked people all day? Well, technically during a massage no one is ever really naked, because even if you're not wearing underwear, you're going to be covered with towels, and it's really only the area being worked on at that specific time that is out in the open, so no one's ever really naked. But also genital areas will never be exposed either. The aim is to make the client as comfortable as possible and maintain their dignity at all times. To be honest though, if you're doing this job, you shouldn't be doing it if you've got an issue with touching people without their clothes on. For me personally, having been a nurse and a midwife, yeah, I've been pretty much everywhere, so nothing really phases me anymore. I can touch people all day, it's not an issue. That probably sounds really wrong. But I think a lot of clients worry that, if we see them out in Tesco's or something later that afternoon, that we're going to be thinking, oh, that was the person who had the, really hairy bum cheeks or the really fat thighs or whatever it may be. Yeah, we don't. We really we might remember, oh yeah, I saw that woman for a massage, she had an issue with her hip, but that's really it. So yeah, clients, you don't need to worry. We see so many people come through the door. We don't remember all the details of every single person. Yeah, I don't think you need to worry about that one. Okay, well, that is all the usual usual questions that I get asked about being a massage therapist. Hopefully it might have answered some of the questions that you may have if you're coming for a massage. As I say, you can catch up with me through my Facebook or Instagram, comment, like, message me. You can also subscribe to my channel on here, but I'm sure clicking a little button somewhere down there. There will be more videos coming, some general videos like today about massage therapy, but a lot more on specific medical issues, muscular problems, sports injuries, how to prevent sports injuries, pregnancy issues. If you subscribe, you'll get notified when they come online. And if you ever have an issue that you would like me to talk about that I haven't posted on yet, please feel free to message me and I will look into that for you. But for now, from the medical massage lady, it's bye for now and see you next time.